All right, welcome everyone. Thanks for joining. For those of you that don't know me, I'm Suzanne Morley. I'm a Health Promotion Program Coordinator with the Wisconsin Institute for Healthy Aging, or WIHA as we call it. And I'm glad to welcome you to this webinar to share a little bit more about our request for proposals for our localizing efforts to address falls, or LEAF Mini-Grant. So if you're not familiar, I did see some kind of newer, unfamiliar emails and names in the registration. So if you're not familiar with WIHA, we are a nonprofit administrator of evidence-based healthy aging programs and practices. And we also convene the Falls Free Wisconsin Coalition, which is a statewide falls prevention collaborative made up of local falls and injury prevention coalitions, community-based organizations, health and managed care providers, public safety, and more. So we're working to reduce falls in the state. If you're interested in learning more about the coalition or getting involved, I do encourage you to visit our website and sign up, and I'll share that link at the end of the webinar. So we know that research shows that falls are a leading cause of injury and death among older adults. If you're here, most likely that isn't new news to you. Falls are a major contributor to emergency room visits, hospital stays, nursing home admissions. The CDC reports that more than 1 in 4 older adults falls each year, which puts, their health and independence at risk. So falls affect families, they affect caregivers, EMS providers, healthcare systems, and entire communities. We know that falls are the #1 reason for EMS responses, for injuries, but we also know that falls don't have to be a normal part of aging and they can be prevented. So we're excited to be able to offer this request for proposals to help, identify strategies and invest in proven prevention efforts to support the independence of older adults throughout the state. I'm going to provide a brief overview of the 2025 LEAF Mini-Grant opportunity. We'll hear from a few of our past LEAF grantees and then open it up for Q&A. So feel free to drop questions in the chat throughout, but there will also be some time towards the end for questions. So important dates, obviously we're here today with a Q&A session. The RFP was released a couple of weeks ago. Proposals are due on September 23rd by 11:59 p.m., so end of day on September 23rd. The grant period will start October 1st of this year and then will end April 30th of next year, so about 6 months or so. And then a final report will be due on June 30th. All of this information, the RFP and all of that is on the website where we have it linked on the screen, and you'll get the slides and everything after the presentation as well. And we're doing this LEAF Mini-Grant opportunity as part of a larger grant that WIHA has received from the National Council on Aging, so we're thankful for the national support. So eligibility to apply for a LEAF Mini-Grant. You must be a nonprofit organization in Wisconsin, and projects must support falls prevention efforts in older adults, which may also include their families and caregivers. Preference will be given to projects that address the needs of populations of the greatest social and economic need and include sustainability measures or lead to next steps for preventing falls in your community or target population. Funding and expenses, we will be funding a maximum of 6 projects in the amount of up to $5,000 each. So you don't need to, request that full amount if you're not going to use it, but you are definitely welcome to request up to $5,000. We do have a budget template that's provided on our website, also shown on the screen. There's a couple, different funding limitations. Funds may not be used for personnel. Funds may be used for personnel, I should say, but not to exceed 25% of the award. Materials, promotions, supplies, and incentives can be purchased, but those incentives should not exceed 10% of the award amount and should not be direct cash. And then funds may not be used to supplant existing funding for food, capital expenditures, or lobbying. So if there's ever any questions about the budget, feel free to reach out. Of course, use the template that we have provided. There's a Word document version of it on our website. And of course, you can feel free to add rows as needed. I'm just going to briefly go through the application as well. That link is in the RFP and also on the slides. But we have a couple different sections in the application. It is fairly brief. but it is something that you do have to complete all in one go. You can't save and come back to it. So you can always, copy and paste the questions and do it in a Word document. And then when you're ready to submit, transfer all that over. But we'll just need the general applicant information, information about your agency, contact information, and all of that. Information about your project, so your proposal, what geographic area is being served, and then the funding amount requested, your project description, 1 to 3 SMART goals, information about your project's activities, partners, and roles, how you plan to address reaching the populations of greatest social and economic need in your target population, and then information about sustainability. And then we'll need you to submit that project budget as well. And then optionally, you can submit some letters of support. So that is not required, but you can submit those if you want to do that. We did do this LEAF project back in 2023 as well. So if you're interested in learning a little bit more, and again, we'll hear from some of our past LEAF grantees very shortly, but we do have a grant report, a final report from our 2023 round of LEAF grantees, and you can see on the screen who was all awarded a LEAF grant back in 2023. And in the final report, we have information for each of the grantees on their activities, their partners, outcomes and lessons learned, and then, kind of next steps in sustainability after that grant ended. So definitely take a look at that. There might be some ideas in there, but definitely think outside of the box as well, and don't limit yourself when you're thinking of your project plans. I'm going to pass it now to some of our past LEAF grantees, starting with Jamie from Marquette County Health Department.
Hello, everybody. My name is Jamie Sofa, and I am the health officer for Marquette County. And unfortunately, the wonderful nurse who spearheaded this project when we had it here in Marquette County has retired, and so I can't have her talk about the really cool things that she was able to do with this grant, but I will do my best to do it justice while you're stuck with me. So as Suzanne had mentioned, we were a LEAF grantee in 2023, and some of the primary strategies that we were hoping to enact during our time with this grant were improving upon relationships that we have with our EMS department. So Marquette County is unique in the state of Wisconsin in that we have an actual internal EMS, county EMS. I think that's only happening in 3 or 4 other counties in the state. So it was kind of nice to be able to work with an internal partner in that way. But our hope was to be able to engage with those partners and really draw from the information that they've learned from responding to folks that are having falls within their homes, or what they like to call lift assists. So this was one of the primary strategies we had, which was to work with our EMS departments to say, hey, who are our frequent flyers? The individuals that are calling regularly because they've fallen in the restroom, or they've somehow managed to get on the floor and they're unable to get back up and they need assistance in that way. And they were really wonderful in helping us sort of identify maybe a top 10 or 15 individuals who could really utilize some additional assistance. So then once we had identified the folks that could really maybe use some additional help, whether it was, within their home or within their lifestyles or whatever it may be, the next approach was to then do a multidisciplinary home evaluation. So Dawn, who was the nurse who ran this program at the time, did a really wonderful job of reaching out to some of our community partners. And so we actually would go out to these individuals' homes with a nurse, a pharmacist, an occupational therapist, and a dietitian to talk through all of the risks of falling. So they would do a home evaluation to see if they had rugs that were, a particular tripping hazard, or to see if the medications that they were on could be causing dizziness or neuropathy or something that would make it a little bit more challenging for them to walk or maintain balance. The occupational therapist would work through a couple exercises that might help them with the areas that they felt they were weakest in. And then after those initial visits, our nurse would check back regularly to see, how are your exercises going? Did you have additional questions for the pharmacist? During that time, while we were operating this program, and these are folks that were calling in pretty regularly with some lift assist needs, but during the course or after, they had this visit with our nurse and through the end of the program, I can't remember the exact number, but I want to say that it was like a 50 or 75% reduction in falls for those particular individuals because of the help that they had received during that time. So that was the approach that we took for helping individuals. But because we also wanted to work amongst the community and make people aware of the resources and the importance of maintaining healthy lifestyles and making sure your home is set up for aging and things like that, we also had educational events. And again, those featured some of those very same partners. We had, physical therapists, occupational therapists, pharmacists. They were incredibly well attended. We had Oh, we actually ended up hosting additional events because we ran out of space for all of the folks that wanted to come and learn more about this stuff, which is not something that we experience very often in public health. So we were really pleasantly surprised and also scrambling. Like I said, we've never really had to do that before. So, and in a community that has a fairly significant aging population, I suppose we should have expected that, but we were really glad to see how excited people were to learn about it. So these were the things that we did primarily with the funding while we had it, but we wanted to make sure that as we left this grant funding period, that we were doing something to sort of help continue on this work and to help prevent those falls as people age, healthily in their homes. So as part of this, we started up the Stepping On program, and that is something that we do continue to put on until this day. And we do tend to have a pretty good number of people who will utilize that program throughout the year. So that's been really fulfilling. But we were definitely able to do a lot more of the intensive one-on-one help for individuals that really needed it during this time. And then I didn't have a presentation for you guys today. However, we did, as one of the community events, our nurse had a number of presenters who came and talked, but then there was also a lot of discussion about, how to do healthy aging. And so one of those things was to stay active, right? They wanted to make sure that people were continuing to do things that would keep them active. And so one of those events actually included a polka. Oh, never mind. I was going to share. Oh, share.
Share now.
Okay. I just wanted to show you some pictures from that event, which was pretty cool. They had, like I said, they had a polka and people had gotten up and they were dancing and there was a lot of resources and it was just a really good event overall. And in the top middle picture, the lady standing to the right of those poster boards, that's Dawn. She was the nurse who did this for us and she really did a fantastic job. The gentleman who appears to have fallen is a cardboard cutout. That's not an actual human who fell down. I had to do a double take with that picture, so I just want to make sure that's what everybody else sees too. But it really was a pretty cool opportunity. We got a lot of really great feedback from community members who participated, and we did see a reduction in falls for folks that did participate. So that's all I have from Marquette County, and I guess, does anybody have any questions?
Thanks, Jamie. I was trying to look for that specific number too, but I can't find it just by looking really
Yeah.
quick right now. But it's awesome to, hear that you guys are continuing with the Stepping On and other activities. So thank you for sharing. If there are any questions, feel free to drop those in the chat, but otherwise I'm going to turn it over to Dana.
Thanks, Suzanne. Hello, everybody. My name is Dana Lawson. I'm the Health Promotion Coordinator at the Aging and Disability Resource Center of Portage County. And I'm going to see, oh, you got it. Thank you. I also lead the Portage County Healthy Aging Coalition. And in late 2022, we applied for this grant, really looking to gain momentum coming out of the pandemic. Our programs were starting back up, but they weren't at the capacity that we thought that they should be. We knew that we could reach more people, and we felt that this grant would help with that, and it did. This project sparked a lot of creativity and excitement within our coalition. You'll see here some pictures from our 2023 annual falls prevention event, and it was really successful. That was exciting. We knew that the success would carry over into the future. And I still believe that it's paying off, and we'll talk about that more a little bit later. We can move to the next slide. So our goals were to develop and revitalize the Portage County Healthy Aging Coalition, to enhance the annual Falls Prevention Resource Fair, and then to increase access to falls prevention resources and activities. And then I just want to say real quick, originally we had so many different ideas, and it was kind of hard to narrow them down. But we did eventually narrow them down to these three, and they kind of all overlapped and with our activities and how they turned out and everything. So just wanted to mention that, because having these opportunities is exciting, and then you think, oh, I want to do this, I want to do that. But it's really good to try to narrow it down, because otherwise it's maybe overwhelming. All right, so to develop and revitalize the Healthy Aging Coalition, we increased our meeting frequency. So we had previously been meeting quarterly, but we changed our frequency to every other month, and then we also added additional meetings as needed. I also incorporated some team building activities, and then we hosted meetings in different places just to kind of change things up and keep things exciting for coalition members. And then we also encouraged member recruitment and encouraged members to work together to work on projects. We collaborated with the emergency services in Stevens Point and Amherst to develop public safety referral systems. And then we began regularly surveying the coalition just to kind of see what was important to them. And then what else did I want to say? Just increasing our meeting frequency and kind of changing things up created space to become more familiar with each other and the different organizations that are on the coalition, which also created space for more collaborations. To the right on the bottom, you'll see Mid-State Independent Living Choices, and then another organization called Welling Kitchen, Bath and Floor, who partnered up to work on a program that helped, I guess, the kitchen, bath and floor understand accessible living, and how they could promote that in their work. And then on the top, you'll see some second year UWSP Department of Physical Therapy students conducting balance and gait assessments at the 2023 event. And we can move to the next slide. So the next thing was to enhance the annual Falls Prevention Resource Fair. So we collaborated with UWSP Department of Physical Therapy to offer balance and gait assessments for the first time. We had never done that before. That was a huge success. We also partnered with a local church to host the Falls Prevention event. The coalition was kind of itching to try something new, and then we thought that this would help us reach more people, and I think that it did. We saw a lot of unfamiliar names and faces at the event. And from what I heard, it sparked a lot of conversation within the church about the event, and a lot of people who went to the church went to the event. We also partnered with the ADRC nutrition program for the first time to offer lunch and learn sessions, kind of just to make it more of a conference and educational experience rather than just a resource fair. And then we also purchased and disseminated 100+ falls prevention items. So we gave every single participant a bag that had a folder and some resource packets, and then a pen with the coalition's phone number and name and logo, and then also those personal alert keychains. And then we also did a raffle, which we usually do at the event, but usually each organization would bring a basket or something, but we were able to add to it. So with the help of this grant, so we gave out 10 of those like grabber reacher things, 10 or looks like I think 20 power outage night lights that you can also use as flashlights, and then night lights, toilet lights, and car canes. And in the resource packets, we had the some study toolkit items, and then also information to fill gaps that we couldn't cover at the event. And as far as the lunch and learn sessions go, we partnered with UW Extension FoodWise program to talk about strong bodies. And then we partnered with Advanced Physical Therapy Associates. One of their physical therapists talked about just the basics of falls prevention, and it was more of kind of like a motivational talk. And I think that covers all of that. We can move on to the next slide. And then to increase access to falls prevention resources and activities, we arranged free shuttle rides with our transportation system, Central Transportation, to the annual event and evidence-based programs. And then we also had a lot of interest in this program. The year before that, we had about 50 participants. And then this year we maxed out our maximum capacity, which was, I think it was 88, 77 showed up to the event. But since we had a maximum capacity, we had to create a wait list. So the coalition committed to offering an overflow event the following March, and we did follow through with that, which you can see a picture in the bottom right corner there of. We also developed a sustainable marketing campaign for the coalition and the event. We invested in some vinyl banners that organizations can hang up like in front of their businesses.
Right.
Oh, that's okay.
Oh, I don't know what happened there. Just kept going.
Okay, there we go. So we had big banners. We also had created some refrigerator magnets that have the date that we'll always have our event. We made some placemats that we distributed at different cafes and restaurants and here at the Lincoln Center and our dining sites. We had event tickets, we had mailing invitations, we had yard signs, a whole bunch of different things, and we can basically just kind of reuse most of those that are reusable, but then also just kind of plug in the new information from year to year. And then we purchased safer storage and more equipment for the Strong Bodies program. Since we were highlighting that program at the event, we were anticipating growth in that program. And then we also purchased a second Stepping On kit to offer more workshops throughout the county. And then we included the nutrition program as well. So that the point of that would be to connect seniors with that program. And let's see. Leading up to the event, we also conducted community presentations throughout the county just to increase the access to the events and the programs. I think that was it. So we can move on to the next slide. Our partners were Holy Spirit Parish. That was the church that hosted our 2023 event. They allowed us to use their beautiful MPR, or multi-purpose room and kitchen. They helped us promote, and then they helped with event setup and cleanup. Our coalition members helped organize, promote, recruit, and carry out the events and activities. We also utilized some volunteers that helped us promote, serve lunch, and carry out event activities. And then there were countless businesses, organizations, and churches that helped us promote and carry out event activities as well. We can move on to the next slide. So our project outcomes, we have so many. I could just keep adding and adding because I think I like to always attribute our success to this. honestly. So we increased our participation in the Healthy Aging Coalition. We welcomed 3 new members that year. And then we increased the overall enthusiasm and support from the coalition and community members to participate in our activities. And we also enhanced the annual event, falls prevention event. UWSP Department of Physical Therapy added the annual event to their second year student curriculum. So they'll be back every single year. So that's awesome that we locked that in. Our attendance increased by 54% that year. And then 86.4% of survey respondents said that they enjoyed the event and were satisfied with the topics. We also gathered some data for future topics to cover that the participants wanted to see. And then we built an event mailing list of over 100 people. So we can invite them every single year. And then we increased access and participation in falls prevention activities. 76% of event respondents plan to attend Strong Bodies or another evidence-based program after that. And we recruited 5 participants from the overflow waitlist to attend a stepping on workshop that was happening just like a month later. And then we connected 59 new participants to the ADRC nutrition program. Since then, we now offer ongoing UWSP Balance and Falls clinics at the Lincoln Center. So they do in-depth assessments for seniors and then give them treatment plans. And then the participants will come back and they check in and they do all sorts of stuff. So that's really exciting and people are really enjoying that. And then we're also planning pop-up clinics as well with UWSP. So we would be able to offer those clinics throughout the county at different meal sites. And we have seen continued growth in ongoing evidence-based exercise programs. We're honestly busting at the seams. So now the problem is, how do we serve all these people and continue? But it's a really good program or problem to have, and we're excited. So before this whole thing happened, we had 139 regular attenders in our evidence-based exercise programs, and now we have 185, and we actually have discontinued 2 of our programs. So we've still seen a lot of growth despite that. And then our annual event continues to be really popular. So in 2022, we had the 50 participants. In 2023, which was the event that we kind of beefed up with this grant, we had served 77. And then at the overflow event, we served 40. In 2024, we served 140, and now our maximum capacity this year is 145. And like I said, we have the ongoing UWSP Balance and Falls clinic as well. So we're continuously serving people, and I think that it's thanks to this event or this project. And we've also built we've had ongoing wait lists for evidence-based workshops, and we're still receiving referrals from emergency services. And we've also hosted a stepping on workshop at the fire department. We're working on hosting one at the library as well. We're just constantly doing lots of things, and we're very busy. And yeah, I think that it's definitely because of this project. So thank you. Does anybody have any questions?
I see one question in the chat. You mentioned that there were suggested topics from the attendees to be added. Do you remember what those were?
Yeah. So I think there was footwear, nutrition, bone health, medication. There might have been more. And then last year we covered footwear, and we covered, what else did we cover? We covered medication, and then we also had somebody come in and offer bone density scans as well. So we're working on covering those topics as we go, and we decided that we're going to survey participants every year just to see, it gives us ideas too, what we can look for and what we can offer them.
Another question, were there referrals from EMS for the Stepping On program?
So the referrals that come from EMS will first go to the ADRC, and then depending on the situation, then it would be sent to It could be sent to me for evidence-based programs, or it might be sent to one of our information and assistance specialists, or it could be sent to an elder benefit specialist. So it kind of depends what that person needs. But I have recruited people from those referrals.
It looks like that's all the questions so far. If there are more questions, feel free to drop them in the chat, but we're going to move on to Danielle.
Hello. All right. Do you want me to share?
Totally up to you.
Okay, I'm going to share, I think, if I can do this correctly. All right, how are we looking? Does everybody see what they're supposed to? I hope.
Yep, looks great.
Okay. All right. Good morning. I am Danielle Jokey from De Pere Health Department, one of the public health nurses here. So I'm going to talk about our LEAF grant initiatives, if it's going to let me click through. There we go. So this is the page that was published for the LEAF grant for 2023. We did have a little bit more grant dollars at that time, so just keeping that in mind. I show the budget on the next slide, so it will look a little bit different, but we had some goals of increasing our fall data. We have this problem with all of public health. We are a city health department within a county, so a lot of our data, fall related or otherwise, is county level, not city level, which makes things kind of tricky. So trying to get at some of the city level specifics. And then our goal was to hold a fall education session within city limits. Our residents don't like to travel outside of the city or even across the bridge. So wanted to have something. We have an ADRC within the county that does serve our city as well. That's outside of our health department, but they don't like to move much outside the city. So having something here in town. We initially had I had found a fall prevention bingo, like a one-time thing, that we were going to do at an event. And WEHA came back and said, hey, there's this evidence-based program called Bingo Size. Would you guys be interested in doing that instead as part of your LEAF grant? So that is what we did. I hesitated to put my budget on here, but I think it's helpful to see, again, there's some different parameters for this budget or this grant session, and bingo size has gotten more expensive since 2023 when we did our license and things like that. But we did end up doing bingo size. We did a Mugs for Rugs event. I'll talk about all that in a minute, but this is kind of the breakdown. Some of that is prizes for bingo size. There is a license that's involved. There's a training fee that's involved. We needed all the equipment. And then there were some items for some of the events and then publishing our data as well. So fall prevention booklets. And then the personnel we had at that time, we had some COVID LTE staff that were kind of transitioning down from some of that work, but still employed with us. So we, transitioned one of them over to do some fall prevention data collection for us. So Jamie, went through every day, and I will get to that too, I guess, and did some fall collection data for us. So just timeline of events. We started in January with the data collection. We had our first bingo size class, which is usually a 10-week class, 2 sessions a week. That was in April of 2023. We had 7 participants that first class. My one that's coming up in September is maxed out at 35, so we've grown since then. And then we ended that data collection in July. That's all we had the money to do. And then we helped with our community center senior picnic, did a Mugs for Rugs event in September, and then another bingo size session in September of 2023. So for data collection, again, we did that 6-month time period. That data came from Image Trend, which is our De Pere Fire Rescue software program that they use to track their visits. Our city health department is just City of De Pere Health Department, but our fire rescue does Ledgeview, Lawrence, and some surrounding areas. So that's been a tricky thing. So Jamie went through each incident, looked at address, made sure we were only pulling out those City of De Pere limit individuals, and then looked at where are they falling. And we did have to add some things in for EMS to answer to be able to do that, but where they're falling, both whether it's an apartment complex or a home or a long-term care facility, and then where within the home, bathroom, bedroom, things like that, ages of falls, genders of falls, times of falls. She looked at all kinds of stuff so we could kind of get that snapshot. So this does show, I just put up the place of the falls as a demonstration, but we had one apartment complex that was accounting for 11% of our falls. And we had 160 falls in that 6-month time period for a population of 25,000 people. So it does keep them busy. So we did publish all that data collection once we had it collected, and that was in our fall prevention resource guide. So it highlighted all of that data, and then we gave resources throughout the community for our older adults. And we distributed those at farmers markets and beer gardens. And I went to a lot of our senior housing complexes and delivered those in person as well. I brought Stanley, our fire therapy dog, with me a few of the times, which was, he was a big hit, way more than I was. So that was super great. And then we included those fall prevention guides in our little goodie bags for our community center senior picnic, which included File of Life, which is where they put all of their emergency information, allergies, emergency contacts, medications, all that kind of stuff that they plop right on the fridge. So our older adults can have all that information on the fridge. If they have to call 911, our EMS personnel look for that on their fridge. Just helps in general. And then some other, mental health magnets and guides. There was some stroke prevention, little goodies, hand sanitizer, all that kind of stuff. COVID tests, which again, this is still kind of COVID-y times. Mugs for Rugs. So we did this through Brown County Falls Prevention Partnership, which is our local fall prevention coalition. We added this on to an event I helped plan with them. So that was part of a bigger county-wide initiative, but we collected scatter rugs, throw rugs in exchange for a coffee mug, which is something that Oshkosh Fire Department had done a few years prior to this. So I had called the gentleman who had helped with that program at that time and chatted with him about how they implemented. And I think, I don't know if they had a super enthusiastic response, but they definitely had a better response than we did. Unfortunately, at least this first one, I think we had maybe 3 or 4 rugs. So it was really ambitious, the amount of coffee mugs we ordered versus the amount that we ended up giving out. But we have done some Mug for Rugs drives since then, multiple, and I've helped the ADRC. I've given them some so that they can do some Mugs for Rugs drives and done different things like that. So still, we still have some and we're still using them, but that one didn't go as well as I had hoped. But the event went great. We had, 100 or so people, and I had all different kind of fall prevention topics and pharmacists, and they did balance screenings and some really great stuff. So, and we've continued to do that every year. So then Bingo Size. So Bingo Size is a fall prevention evidence-based program, and it's bingo, health trivia, and exercise. So it's a twice a week for 10 weeks. There is one that's shorter than that. And it's about an hour, and we do some introductions, some talk about falls. There are a couple different topics. There's fall prevention, nutrition, immune support. There's an exercise only. I think that's all of them, but they all have different trivia, but all of the exercises included in the program are meant to support fall prevention through balance and strength. And they have a lot of fun. So it's set to music, and it's all oldies, and they love it. We have a lot of fun. We have some disco lights. I have more pictures I'll go through here, but We do a couple bingo rolls, then a couple exercises, then some trivia, then a couple bingo rolls. So again, I'm up to about 35 older adults. There's a core group that have done it every time, but we do get some new faces and things like that. So there's Stanley on the floor there, the therapy dog from fire rescue. But they have their t-shirts, so that was prizes one of the time. They all wear them. They're fantastic. There's one of the other groups. So this will be our 6th session. So yeah, we did 2 in 2023, 2 in 2024, 1 in 2025 so far, and September will be our second one in 2025. So they have a ton of fun. They love it. They are mad at me that I don't do it more than twice a year. They don't like the break in between. It's been great. So I think I have one more. Oh no. So yeah, that's our bingo size. So that's been a huge success and something we've been able to continue doing. So continuing effort, Steps to Safety is our fall and fire prevention program. It's a one-time in-home assessment where I am a nurse, and then one of our firefighter EMS personnel, Tony, sometimes some other people rotate in, but we go into the home and take a look at grab bars, throw rugs, medications. Last time they had an eye exam, that kind of a thing. But again, it's a canned program. There's a checklist. And it's a collaboration between fire and public health, which is great. So we do offer that, and a lot of the night lights and medication bags and the fall prevention and resource guides and things like that come with us on those visits. So that is again still using some of those things from our initial LEAF grant. Out of our data, I was trying to read questions at the same time and I lost my chat, but I'll take a look at those. I know somebody asked something about the senior housing apartments. But so we did find that there were certain apartment complexes, which ended up being one of our low income disability housing and older adult housing areas, that was both a fall hotspot and was on our CDC social vulnerability index, and just wanted to do some specific programming there in general, but also tailored to falls. So we have Grapevine Nursing, if anybody has heard of that. It's a chronic disease prevention program that's presentations, again, canned presentations. It's all researched and ready for you, but we did a bone health one there. We also did a Steps to Safety fall and fire prevention with like mini home inspections, apartment inspections for the older adults there as well. So did some targeted education at that hotspot specifically, and then have done some other chronic disease education there as well. And then brought them older adult resource guides with Stanley, of course. And then continuing work, coalition work, have continued to have that Freedom from Falls event every year. ADRC is now doing bingo size as well, which is fantastic to see. So I've been helping each other with those sessions. And again, continuing the mugs for rugs wherever we can. But I think that is most of our ongoing efforts. Again, bingo size has totally continued and we love it. Our community center has taken over the registration for that, and I think eventually we have one of the community center exercise instructors that is a bingo size instructor as well. So kind of slowly transitioning that over to them. So long term, it is a lot of time, so that's been great as well. Okay. Let's see. For one apartment complex, was it larger than the other complexes? It was not necessarily larger. It is one of the bigger ones for sure for the senior housing, but not at all the largest, and not at all like a lot bigger than other apartment complexes in general, but one of the bigger older adult apartment complexes. So it was expected that they would probably have more trouble. And again, it's low income, it's older adults and older adults with disabilities, or just in general. So it was good for us to recognize that they needed a little bit of extra attention for us to make those relationships. So that was really helpful. So yes, we have done some stuff to help support them. Requirements for bingo size lead coordinator. It can be a lay person. So we have our administrative assistant who is trained, two of our nurses, including myself, and then again, Gina is just one of the community center exercise instructors. It definitely helps if you know you're like being around people and have a loud voice and are comfortable leading a class. So I don't think there's actually any hard skills that you need, but those things go a long way. They love our enthusiasm, and if you don't have a microphone, you got to be loud. But other than that, there's not really any requirements. Anything else?
Seen anything come through the chat, but if there are other questions, feel free to throw them in.
Okay.
And I'll just open it up now just for questions in general from our LEAF grantees that presented from 2023. Any general questions about the 2025 RFP? I will just reiterate what Dana said about, kind of narrowing down your activities, and just remember that the 2023 LEAF grant was larger than our mini grant that's currently out. So you might be like, wow, they did so many things, and like they had more funding, they had more time. So keep that in mind when you're writing your proposals as well. Well, I'm not seeing any questions. So you can always feel free to reach out to me if you have my personal email. Otherwise, the falls@wihealthyaging.org, just easy to remember. You can reach out to that one as well. It's also on the RFP. Visit our website, look through the RFP, kind of look through those, ideas that are on there, but definitely think outside of the box. Use your partners as well. Oh, Matt, you said you have a question. Go ahead. You can either come off mute or share that in the chat. And I'm not able to hear you.
Alright, how about
There
now?
we
Can you hear me now?
Yep.
Oh, perfect. Awesome. So, I guess two questions I have. So, I work for a rehab agency, and we are a for-profit company, but I've developed this Aging Gracefully class. It's an 8-week educational class talking about more wellness and lifestyle prevention of injuries. Would I qualify for that, or should I partner with like a falls coalition to get submit it that way?
Yeah, so it's only open to nonprofit organizations to submit the RFP.
All right.
Yep.
All right. So I am a part of a coalition in Dane County. So I'd have to go through them for applying for the grant.
Yeah, you would have to partner with a nonprofit organization or coalition. Yep.
Right. I can do that. That's easy enough. With that, also for the budget, I have like $100 fee. I partner with senior centers. I've did 4 classes so far that hosted and helped me fund 4 classes that I would go there for 8 weeks in a row and give these 1-hour sessions. I don't see any besides like my fee to attend the class. What could I potentially do for the budget? I guess we could do like potentially promotional and like printing off materials for the class. So
Yeah, I'm trying to look for it here. So Yeah, that would really be up to, you know, whoever's submitting the RFP, what to put in the budget. And again, you don't have to request the full $5,000 if your project isn't going to require the full $5,000. But just look at the project budget, and you know, the expenditures that you're not able to use, or if you need to add anything to this, you can as well. But you know, incentives can't exceed 10% of the project award and can be direct cash. Travel can't exceed 10% of the project award. Personnel can't exceed 25% of the project award, and make sure to look at those stipulations.
So with my class, I have like a $100 fee for me to go to present the class at a senior center. Would that be classified as a personnel fee, or what would that be classified as?
Why don't you send me an email about that?
Right, sounds good.
Yep, we'll talk that through offline.
Perfect. Thank you so much.
Mm-hmm. Yeah, and if there's any other specific budget questions, anything like that, definitely feel free to reach out.
Right. I for sure will reach out with a few questions.
Sounds good. Any other questions before I close out? All right, well, I'm super excited to see everyone's proposals. You can kind of see from the 2023 grantees, work is still continuing to this day. There's lots of excitement about it and passion about it, which is super exciting. I want to thank our sponsor, UW Health, for supporting Falls Free Wisconsin. And I will be sending out a recording of this webinar within the next week. It'll also be on the RFP section of the website. And everyone who registered will receive a copy of the recording and future communication from Falls Free Wisconsin. And again, just feel free to reach out if you do have any questions. Thanks, everyone.
Bye, thanks. Have a great day.
We'll be sending out the slides as well.